Good evening, I'm Andrew Chang. Adrian is away. Tonight, a man who survived the tragic bus crash in Jasper National Park tells us about his girlfriend who did not.
I just kept telling her, I'm sorry, Dion, I love you.
And from those who ran to help, what they heard and what they saw. Also tonight, the hopeful signs in some new COVID-19 vaccine research.
We are optimistic may be associated with protection.
What it means for Canadians.
Young people thinking that they're a little bit more invincible, like not worrying as much.
Public health officials across the country point to a troubling trend. And when it comes to the We charity contract, the opposition presents the Liberals a choice.
It's either corruption or incompetence. Which is it?
Why the Prime Minister wasn't there to answer. This is The National. From that horrific bus crash in Jasper National Park on the weekend, tonight, new horrifying details are emerging. They come from some of those who rushed in to help when the sightseeing bus rolled down an embankment, and also from one of the men inside it, his girlfriend, one of the 3 people killed. Rafi Boudjikanian has their stories.
At the scene of the crash, crews are moving the wreckage slowly.
The area of the crash is very steep, very dangerous for the responders, for the crews that are coming in to remove it.
But images of the crash itself are seared into the minds of witnesses.
There's a lot of injuries, there was a lot of blood, people were screaming.
These 2 friends were on another bus nearby. They raced to the scene to try to help.
There was a old mom on the ground laying down, just calling for her daughter. And I went around the bus and I saw about 4 more people just badly injured.
Strangers delivered first aid and helped any way they could.
So I picked up about 4 phones, about 5 wallets, and I put them in a bag and I gave it to the man in charge, and he told me that I was a good man, apparently. Yeah.
But Sahim says there was only so much he could do.
There was a couple who was on the ground too. The guy was holding her girlfriend or his wife on his hands, and her girlfriend was had her last breaths at that moment, and she passed away right in front of my eyes. And the guy's reaction was he was screaming, he was in pain, he was praying. I couldn't help him at all.
CBC News has identified one of the passengers who died as 24-year-old Dion Jocelyn DeRoche from Canoe Narrows, Saskatchewan. She and her boyfriend were on the last day of their trip.
The last thing I remembered was falling onto the roof, and then we must have rolled like a couple times because I wasn't awake. When I woke up, I seen my girlfriend laying right beside me. She was barely breathing.
A 2-year relationship that ended far too soon.
I told her it was going to be okay, that people were coming for us, but it was too late. I knew she was already gone. So I just laid there with her. I covered up in a blanket with her, and I put my hoodie on her head.
Police have released details about the other 2 passengers who died, a 28-year-old woman from Edmonton and a 58-year-old man from India.
I wasn't told to cover up the bodies, but in common human decency, I went and covered up their bodies with the blankets.
14 people were initially taken from this scene in critical condition. 10 are no longer listed as critical, and the other 4 are now stable. Police also said today they've ruled out a rock slide as a reason for the crash. Rafi Boudjikanian, CBC News, Jasper National Park.
4 months into the COVID-19 pandemic, some countries have largely contained it, but others seem to be spiraling out of control. So when new vaccine research shows great promise, the interest is global. And that happened today regarding a vaccine trial from Oxford University. Renee Filipponi brings us those details.
3131197. Rolling up a sleeve for science. More than 1,000 people took part in the Oxford vaccine trial.
We're seeing both neutralizing antibody responses and T-cell responses that we are optimistic may be associated with protection.
Which means the vaccine may not only block COVID infections, but help the immune system fight it. Weeks after vaccination, researchers saw peaks in antibodies and T cells, which neutralize pathogens and kill infected host cells. What's not clear is how long those will last.
The difficulty that we have is that we don't know how strong that immune response needs to be.
So now it's on to a phase 3 trial, which is much larger and will determine whether or not it's truly effective. That will happen in places like Brazil, which has the world's second highest infection rate. This virologist is optimistic.
This is quite important to see if the vaccine is efficacious in protecting from infection or protecting from disease. And this will be crucial. And unfortunately, we need to wait.
Life is coming back to the streets of London, but experts say it won't return to normal until there is a reliable and widely available vaccine. And that's unlikely to happen this year.
There are 22 other vaccines in the clinical trial phase around the world, including one here at Imperial College in London.
pH might be different.
The project leader says it's important to have lots because many will fail, and because scaling up production will take time.
We still need to be aware that there may be a big gap between that announcement of a success in a vaccine to making it available to different parts of the world.
The UK government is attempting to get a jump start, already placing orders for 190 million doses of 3 different vaccines, including the one from Oxford. None have been proven effective yet. Renee Filipponi, CBC News, London.
Okay, so let's dig into this a little more with infectious diseases specialist Dr. Isaac Bogosh, who, as you can see from the forest behind you, is not joining us from his office. He's in Georgian Bay, Ontario. So let me ask you, Dr. Bogosh, I mean, how long until we can go into a pharmacy and get a vaccine?
It's still going to be a while, unfortunately. We still have to wait for the phase 3 clinical trials. Of course, the vaccines have to be mass-produced. They have to be shipped. And then they have to be administered. So I think if everything goes perfectly, and of course we know that's rarely the case, but if everything goes perfectly, maybe we'd see vaccines being administered in the latter part of 2020. I think a much more reasonable option is the first quarter of 2021.
And would it be the case then that we would see a kind of staggered rollout where only certain, I guess, priority people would get the vaccine first?
I think that's exactly what we're going to see. And there is a vaccine working group, and we'll very likely see prioritized cohorts of individuals. For example, those in long-term care facilities, people who might be in homeless shelters, probably frontline healthcare workers, people who are at greater risk of having a poor outcome of this infection, or people who are at greater risk of acquiring this infection. I think that's what we'll very likely see.
Okay, Dr. Bogosh, good to talk to you, and we'll be bringing you back into the conversation a little bit later in the program, so don't go too far.
Sounds good.
Now, if you want a closer look at the global effort to come up with a viable vaccine, we have something that we want to show you. So this is a CBC News online interactive showing the top-tier vaccine candidates from Canada and around the world, including the ones we just discussed. It tracks how far development has progressed, explaining the main approaches that the different vaccines take, along with the pros and cons that come with each of those approaches. You can find it by searching for CBC News Coronavirus Vaccine Tracker. Now, even without a vaccine, Canadians have generally managed to get a handle on COVID-19, but some provinces are seeing an uptick, enough for health officials to be concerned. While Ontario and Quebec are on a downward trend, seeing fewer daily cases, BC, Alberta, Saskatchewan, and Manitoba are all on an upward trend in recent days. Since Friday, British Columbia has reported more than 100 new cases, and Alberta more than 360. Now, health officials are also seeing another troubling trend. As Vic Adopia tells us, it's about who is getting infected more than before.
So I'm just going to need to grab a name and phone number for you.
Contact information is the price of admission at a lot of restaurants these days, a precaution in case anyone tests positive for COVID-19. As more businesses reopen, some may take that as a signal to ease up.
Young people thinking that they're a little bit more invincible, like not worrying as much. So I think young people are definitely socially, being more social lately, unfortunately.
Despite recent clusters of cases, Canada has still managed to keep the curve flat. But for the second week of July, Canadians in their 20s accounted for a quarter of those new cases, the largest proportion of any age group. Public health officials are worried.
The vast majority of these new cases are in people in their 20s, and they are largely related to having attended private parties.
And those are the situations where we can pass this virus on. And it's very challenging for our teams in public health to find all the contacts in a timely way.
It was the same story in Montreal, where young people were urged to get tested after outbreaks at bars and parties.
And when you drink, unfortunately, it affects your judgment, it affects your inhibitions, and when we're trying to prevent transmission, we sort of need people to be on their guard.
COVID-19 has spared young people for the most part. Those in their 20s account for just 3% of hospitalizations in Canada, which could leave them with a false sense of security.
If you have such a minor infection that you don't even feel unwell, but you spread it to someone else and they die, that is actually a devastating thing to be responsible for that.
Health officials warn unless the spread of COVID-19 comes under control in young people, keeping a second wave of infections to a minimum will be unlikely. Vic Adopia, CBC News, Toronto.
Now, this Friday, more parts of Ontario will officially join those other regions within the province already in stage 3 of reopening, but with some notable exceptions. Toronto, Peel Region, and Windsor-Essex will remain in stage 2. And a note of caution for those entering stage 3, Ottawa, which did so last Friday, reported 20 new infections today after weeks of single-digit increases. Well, Quebec police say they found what they believe to be the body of Martin Carpentier, the father of 2 girls found dead 9 days ago in the same area. Now, police say they were acting on a tip, and it appears the man may have taken his own life. The news comes just hours after a funeral was held for the young sisters. Jayla Bernstein has that emotional scene.
Nous avons eu que trop peu de temps.
2 lives cut tragically short. 11-year-old Nora Carpentier and her little sister, Romy, age 6. This man helped search for them.
That's sad. Very sad.
Others from the area, many complete strangers, came to pay their respects. Nora was a Cub Scout and Romy was about to become a Beaver Scout. They were last seen alive at a convenience store with their father. Shortly after, their car was found crashed and abandoned. 3 days later, the bodies of the 2 girls were found in the woods. He says the story deeply touched him. He lives nearby and says it's terrible what happened. Today's service was a celebration of life as the family wished.
They wanted to really put the focus on the life and the joy, the happiness, the brightness that the girls brought throughout their life.
She says she told the family she would handle things as if they were her own daughters.
It's the kind of call that you always wish you're never going to get. Just because, not because you know you can't do it, because of course we always can, but just on a human point of view.
While family and friends honor the girls' memory, many questions remain. Jayla Bernstein, CBC News, Lévis, Quebec.
Investigators have managed to pull information from black box recorders more than 6 months after Iran shot down a Ukrainian passenger jet as it left Tehran.
They have been successful in downloading the voice recorder, and therefore that data could certainly share the discussions the crew was having in the preparation leading up to the departure and up to the missile strike.
Canada has 2 investigators in France, but physical distancing requires they watch the process from another room through a live video link. 55 Canadian citizens and 30 permanent residents were among the 176 people killed. Well, Justin Trudeau did not attend the resumption of question period today. It would have been the opposition's first chance to ask the Prime Minister about his family ties to the We charity and how it was chosen to administer a $900 million student grant program. David Cochran shows us how that went over.
Why is the Prime Minister taking a personal day? And I'd like to ask the Deputy Prime Minister, is everything okay?
Parliament resumed with some mockery of the Prime Minister, who did not recuse himself from the We decision, but did excuse himself from question period.
Part of my job is to be accountable to this chamber when the Prime Minister is not here.
Leaving the Deputy Prime Minister to defend the government.
It's either corruption or incompetence. Which is it?
Mr. Speaker, it is neither.
Last week, Trudeau suggested he would be there.
I'm looking forward to speaking next week at Parliament. I know there'll be a range of questions from opposition parties.
L'honorable député de Burnaby Sud.
The opposition showed up.
Will the government admit that this wasn't about helping students, this was about helping their close friends?
But not the person they wanted to question.
The nonpartisan professional public service made a recommendation. I am confident that they did their due diligence.
Today!
This issue has infused politics into the pandemic response. There have been partisan disagreements over aid programs, but the we controversy is getting personal.
Using a national crisis like a health pandemic to line Liberal family members' pockets is morally reprehensible.
Now, a new poll suggests the issue is hurting the Liberals. Their support soared when the pandemic response was seen as driven by public health concerns. Now, a dip, with the whiff of personal and partisan interests surrounding the student grant program. The Prime Minister's office says this absence isn't about hiding from the we controversy. They insist that this day off was scheduled long before Parliament was even scheduled to sit, and that Trudeau will be in question period on Tuesday. David Cochran, CBC News, Ottawa.
And a footnote to this, just hours ago, the We charity announced that co-founders Mark and Craig Kielburger will appear before the Finance Committee a week from tomorrow. The brothers say they look forward to speaking directly to Canadians and setting the record straight, and they will do so under oath. Okay, a high-profile mental health advocate in Saskatchewan is being accused of sexual harassment by 13 women. Jim Demeray was once the manager of 2 Earl's restaurants. Some of the women who worked for him say the experience caused them lasting mental harm. Bonnie Allen spoke to them.
I wanted to make a difference, so I started to Understand Us.
At 38 years old, Jim Demeray has become a leading voice on mental health in Saskatchewan. He speaks to thousands of school children every year and produces awareness campaigns like this.
And I don't accept myself. I don't like my smile.
Demeray started his mental health work when he was still an Earl's restaurant general manager. The same year, he was involved in this video titled African for That. It was played at an Earl staff party in 2011. It shows Demeray and another white man talking about using their cell phones to get directions or play music.
Dude, there's an African for that.
Then a black man pops up on screen to do the job instead. Demeray told CBC News that his black friend wrote the sketch as a satire and asked him to help. He said, "I sincerely apologize if anyone has been offended by my participation."
Next up, we got the award of front of house sexcellence.
In another video, Demeray hands out so-called sexcellence awards to female employees.
Actually, I gotta say that there's a ton of good-looking minors in here tonight.
Demeray says he regrets his participation in that, too. Earl's Restaurant calls those awards egregious conduct and a direct violation of our zero-tolerance policy on sexual harassment. Now, 13 women say Demeray repeatedly sexually harassed them verbally over a span of more than a decade. The women allege Demeray made sexually explicit comments about their bodies almost every day, that he said he had sex dreams about them, inquired if they liked anal sex, and much, much more. Demeray says those allegations are baseless and untrue. Earls confirms it did not receive any harassment complaints against him, but the women say they were too scared to speak up earlier. Bonnie Allen, CBC News, Regina.
Well, south of the border, violent confrontations on the streets of Portland. Up next, a federal agent caught on tape beating a protester. Still, the president is threatening to send in more officers.
What we're going to do, Kay, is give you some that research medication now.
A promising treatment for COVID-19, and the drug is widely available. Plus, when COVID cancels your travel plans, time to get creative.
I made our front door look like Niagara Falls. It was supposed to look cooler than that, but I couldn't get everything taped to the door, so.
How one couple brought Canada to Cleveland. It's our moment. Back in 2. The couple seen pointing guns at protesters outside their St. Louis mansion has been charged. This now viral video was taken last month as demonstrators marched towards the mayor's house to protest racial injustice. The pair have said they were within their rights to defend their property from what they called a mob, but they have each been charged with unlawful use of a weapon. Protesters are still out nightly in Portland, Oregon, nearly 2 months now after George Floyd was killed by a white police officer. Over the weekend, though, violence escalated. And as Katie Simpson tells us, the governor and mayor are demanding Donald Trump pull federal troops out of their state.
Federal agents ordered to break up protests are caught on video beating a man who won't back up, shooting pepper spray in his face.
What are you doing? Use your words. What are you doing?
A few nights earlier, officers dressed in fatigues without badges grab a demonstrator, saying nothing, whisking him to an unmarked minivan.
Kidnapping people. You just violated their rights.
These scenes have outraged state officials who are suing the federal government, arguing these actions are unlawful, demanding they stop.
These federal agencies are operating with no transparency and against the will of just about every leader in our state.
After weeks of protests, Donald Trump ordered federal officers to Portland ahead of the 4th of July. Intelligence suggested demonstrators who had already damaged some buildings and clashed with local police planned to target federal facilities and statues.
Portland was totally out of control. The Democrats, the liberal Democrats running the place, had no idea what they were doing.
Trump is now threatening to send officers to other big cities run by Democrats, including Chicago, where protests continue and unrelated gun violence is surging.
We don't need federal agents without any insignia taking people off the street and holding them, I think, unlawfully. That's not what we need.
Having federal agents in the streets actually appears to be inspiring more protesters, including a new group calling itself the Wall of Moms, linking arms to protect others.
I think what they want to do is scare us away, the feds. They want us to stop protesting, and it's the opposite effect.
Trump sees law and order as an election issue that motivates his base. So he's trying to paint Democrats as soft on crime, arguing he's the only leader who will keep Americans safe. Katie Simpson, CBC News, Washington.
The UK is suspending its extradition agreement with Hong Kong and banning arms sales to the region over concerns about the new national security law imposed by China.
The specific measures I've announced today are a reasonable and proportionate response to China's failure to live up to those international obligations with respect to Hong Kong.
The law gives Beijing more power in the region, and many countries believe it threatens the one country, two systems arrangement. Canada has also suspended its extradition agreement with Hong Kong. Okay, up next, we are taking a closer look at the COVID situation in the United States and what it could mean for Canada when the border eventually reopens. The doctors are in, and later.
Here I am. I'm, about to get married in a couple months. I can't imagine what it was like 15, 16 years ago fighting for this.
Celebrating marriage equality, couples then and now, on how that pivotal day 15 years ago changed their lives. Stay with us. Well, summer is in full swing, and with that, many of us can't help but think about travel. Except, of course, in a pandemic, it's a bit complicated. We're all eager to escape our bubbles, but there are major risks involved, and perhaps the biggest travel conundrum of all, the United States. All the way back in March, the Canada-U.S. border closed to non-essential travel. And every 30 days for the past 4 months, the two countries have agreed to keep that border closed. Poll after poll has suggested Canadians are happy with that decision, but the border won't stay closed forever. And so the question we are asking tonight, what happens when it reopens? Joining me now to help answer that, two infectious diseases specialists, Dr. Isaac Bogosh, who we saw earlier in the program, and Dr. Rewat Deonandan. Hello to the two of you. So, Dr. Deonandan, maybe I'll just start with you so that we're all on the same page. I mean, it's easy to skim through media coverage in the United States and think, oh my gosh, things are really out of control. But give me that sober assessment of how Canada and the U.S. compare.
Well, we like to think of our two countries as being very similar. We have similar demographics, similar language, similar entertainment tastes, but pandemics have a way of revealing the truth of a society, the frailties and the strengths. What this pandemic has revealed of the United States is a fractured society. Now, it's difficult to describe one nation in aggregate when it's so diverse, 50 different states with 50 different experiences, but we're seeing ideological splits, we're seeing tribalism, we're seeing distrust of authority, we're seeing the rampant rolling through society of pseudoscience. In Canada, on the other hand, for the most part, we've seen a unified vision. We've seen most Canadians lining up behind our leaders. We've seen people willing to sacrifice for the betterment of the society. So this pandemic has really, for me, delineated a cultural difference between the two countries around how we're willing to behave to keep each other safe.
Right.
And in the United States, that's gone poorly.
And I take your point that we're talking about two very diverse countries here, so it's hard to sort of brand either one in a sort of a singular way. But Dr. Bogosh, when you look at the numbers, I mean, is the pandemic in the United States sort of clearly and measurably worse than in Canada?
Oh, absolutely, and basically by all outcomes. Even if we just look at the sheer number of cases in the United States, they have somewhere between 70 to 75,000 new cases per day. We have individual states like Florida with anywhere from about 10 to 15,000 new cases per day. And when we think about Canada as a country, in general, we're getting between 200 to 400 new cases today from coast to coast. So Canada has done a much, much, much better job getting their epidemic under control compared to the United States. Ours is rather controlled right now. Of course, we're seeing little outbreaks here and there, but in the United States, it's still a raging forest fire.
So then, Dr. Bogosh, I mean, what's at stake here? I mean, if the U.S.-Canada border were to reopen, I don't know, say tomorrow, what would the health consequences be of that?
Oh, it would be a disaster. I mean, we would certainly risk importing infections across this border. And this is, we have a huge land border. And of course, in pre-COVID-19 times, there was a tremendous amount of travel across that border, both with Canadians traveling to the United States and Americans coming to Canada for business, for pleasure. And it would just basically make a scenario where we would re-import a lot of cases, as we saw before the border was closed. And it would essentially undo all the hard work that we've done to get our epidemic under control.
Dr. Dionanda, do you see it as being that dire? Because, I mean, at the moment, there is travel happening to and fro, certainly not tourist travel, but we see essential travel, truckers, for example, driving back and forth. I mean, what's at stake in your mind? And I suppose, what would you want to see before that border reopens?
I think that our focus should be 100% on finding a safe way to open schools in the fall. Anything that distracts us from that goal is ultimately a disservice to keeping our economy open. The best way to keep schools open safely in the fall is to have our caseload low in the community, in the single digits if we can. Opening up the border in no way serves that goal. In fact, in many ways, it introduces new seeding events. Every American traveler that comes across that border is possibly the source of a new outbreak, and possibly, as Dr. Bogosh was saying, a small forest fire. I don't see this helping our long-term cause in any way, shape, or form. There's nothing good that can come of it, except for the travel of essential goods, as you mentioned, via truck drivers and so forth. Recreational travel might be economically interesting for a few, but the risk is far too great in my mind.
So if the potential risk then, Dr. Bogosh, as you put it, is the undoing of the progress that Canada has made so far in controlling the pandemic, I mean, what would you want to see in terms of, I don't know, either testing numbers or hospitalization numbers or death numbers in the United States, or even from a policy perspective? What is it that you would want to see before that border reopens?
Yeah, certainly it would be great to see some central leadership. And with good central leadership, both at the federal level and at the state level, we hopefully watch them get their epidemics under control. And there'd be a constellation of metrics, reduction in the number of new cases per day, a sustained reduction in the number of new cases per day, and public health policy that really facilitates that a low number of cases can be sustained. But until that happens, I think, for fans of Canadian football, we're just going to have to keep punting this decision month by month by month down the field and delaying the border from reopening, because quite frankly, even if they did everything perfectly today, it would still take months for them to get their epidemic under control there.
We'll have to see how it plays out. Doctors, thank you so much for this. I appreciate it.
My pleasure.
Now, the personal impact of the virus on Canadians has been profound, and a BC survey shows that. Earlier in the pandemic, nearly 400,000 people answered questions about their mental and financial well-being. Greg Rasmussen looks at the results and who has been most affected.
The survey taps into what's going on behind those masks and barriers, how people have been dealing with the realities of COVID-19.
People are out and about and getting some sunshine, but I do think people are hesitant to move forward with what they would normally do in the summer.
The psychological impact of the virus is a huge concern. 52% of families with children reported worsening mental health, with 24% reporting extreme stress and 36% saying they've been drinking more alcohol.
Whether that was anxiety, concern about the virus, fear about losing their job, fear about being able to care for their families.
Younger people, 18 to 29, reported even higher levels of mental health problems.
We both lost our jobs at the beginning of it, and we haven't had them back yet. I live by myself, and for the first March to May was really hard. It's better to get outside, but then now it's like, well, I don't have a job still.
That young people bore a greater proportion of the mental health and economic burden than older adults. And this may in part be because the pandemic has impacted many of the occupations that they work in.
Overall, economic worries have been a big concern. 31% said it's been tougher meeting financial needs. 15% were worried they wouldn't have enough to eat, and 1 in 20 said they would likely have to move out of their current home. The survey also reveals that most have accepted the need to practice preventative hygiene.
I never really changed much. I don't know, I'm a pretty clean person. I always wash my hands, and I don't know, I work in a very sterile environment.
In all, a survey revealing a mix of fear and anxiety, but with some hope for the future. Greg Rasmussen, CBC News, Vancouver.
Well, still ahead, 15 years after same-sex marriage became legal in Canada.
I just bought your ring. What the
Couples then and now on what it's meant. Plus, bringing a little bit of Canada to Cleveland. How one couple found the bright side of their canceled vacation.
We're here today to celebrate the love of this couple. We're called to rejoice in their happiness.
15 years ago today, marriage equality in Canada came into effect nationwide. Bill C-38 removed all remaining barriers to marriage between same-sex partners while providing all the legal benefits and protections that straight couples had enjoyed for a long time. It did not come without a decades-long struggle, but at last, the biggest prerequisite to a life spent together in matrimony was love. For some Canadians, July 20th, 2005 may seem like a long time ago. For many others, it's still pretty recent history. And to be sure, the battle for equality is not over, even as we recognize this Canadian milestone. So tonight, 3 Canadian couples share their stories of coming together and what this anniversary means to them.
I just bought your ring. What the
I hadn't expected to get emotional while I was filming it, but I think, at least at that moment, thought I would be proposing to her. I didn't know that she was going to propose to me just a couple weeks later. Angela proposed to me in New York City in 2018. By the time we get married in October, it'll be pretty much 2 years to the weekend. Our experience getting married in 2020 has been interesting. There's been a lot of really good things, a lot of things that we take for granted, but I think it comes with a whole different string of challenges. It's automatically assumed that I am engaged to a man when most times Angela is standing right next to me. Oh, look, another wedding show, and they refer to us as friends, or they think we're sisters and things like that, even though we're holding hands. Who holds hands with their sister at a wedding show? I don't entirely know.
I don't feel like I'm a person at that time when I hear it, and after, I joke about it, I realize, okay, you know what? We're invisible to some people. Or we're only visible when it's known that we're a couple.
I can't even imagine what it would be like to love your person so much, but want to get married and legally not be allowed to have that opportunity.
I was in high school 15 years ago, and to me, like, I didn't know what was happening 15 years ago. I didn't know that marriage equality was something that we were fighting for, because I was kind of in my own little bubble. I wasn't out. I went to Catholic school. I didn't really know anything, and so eventually I did decide to learn, more about what it meant to be part of the community, because, how could I be part of a community without knowing the struggles?
Hi Rachel. Hi Angela. I'm Maurice.
And I'm Tom.
Hello, Angela and Rachel. I'm Kristen Wong Tam, and this is my wife, Farah Khan.
We've been married for 9 years.
Really?
We met at an LGBT conference in Sao Paulo, Brazil, where I was talking about my work challenging homophobia in the Caribbean.
And of course, our initial interest in each other was purely professional. But then we quickly realized, well, there was a little bit more than that.
We had to get married in Canada because Jamaica bans same-sex unions. And I went back to Jamaica after a wedding to wait for the filing process to be complete. But a Jamaican newspaper got a hold of our wedding photo.
And we had to get him out quickly because there were numerous death threats.
In 2016, we got married, and we were definitely not the marrying kind. Even on our first date, Kristen said, I'm not really interested in marriage or having kids. Lots has changed in 4 years. But for me, it was a big deal because I had family members who told me that I shouldn't get married, and people in my community that told me I shouldn't get married. And as a queer Muslim woman, taking up that space and, thanking the people that fought for me the right to do that was really important.
The marriage equality fight in Canada goes back decades.
Separate but equal is not equal.
Of course, Canada legalized same-sex marriage in 2005, and that was critical.
I believe that marriage equality helps people to see us not just as walking sex acts, but also as people who want to have families.
Just very recently, we've had another milestone, if you will, in the Canadian Armed Forces, and I'm sure in other government agencies. Fertility treatment was only provided to heterosexual couples.
Yeah, and that was recently changed. So we're very, very happy because we're planning to start our own family.
We know that in Canada and across the world that people fought for our right to exist as human beings, to not be killed, and we have to keep fighting as a community, that fight isn't over.
Yeah, and Farah is absolutely right. I mean, homophobia and transphobia, while it continues to exist in the world, we cannot ease up. And there are so many brothers and sisters around the globe that don't have the freedoms that we have here. So we want to send you this message of love and solidarity. We want you to take care of yourselves and each other, of course. And let's always remember community. Let's always remember this love.
Congratulations.
So, best of luck.
Like, here I am. I'm, about to get married in a couple months. I can't imagine what it was like 15, 16 years ago fighting for this. Both couples, fought and continue to fight, and, of course they've experienced a lot more than we have, and, they can see the good that's coming out of it now, but they also saw, I guess, the bad parts. And I just say a big thank you to both of them for stepping up and for being those people that we can look up to and say, that's what I want.
The part about, fertility treatments, the fact that they've been waiting this long to be able to start their family and only just now able to celebrate it, whereas that's always been an option for us. That struck a chord with me. Yeah. Farah looks like me, like she is feminine, but she's married to a woman, and that's not something that I see a lot. So it's nice to look at her and feel connected and see that representation as a feminine gay woman.
When I think of getting married, I'm getting married and I'm going to have a wedding. And it's our wedding. It's not our same-sex wedding. Come to our marriage equality celebration. No, it's just come to our wedding.
Mm-hmm. We just want to have a wedding, and we don't want rainbows everywhere. And for some same-sex couples, that's great if they want rainbows and they want to celebrate that. But that's just not us, and it doesn't make our wedding any less gay because I'm still going to be marrying Angela at the end of it.
That is inspiring. Okay, up next, a potential new treatment for COVID-19. The common drug, repurposed, that is showing early promise. Stay with us. To combat COVID-19, doctors and scientists are heading down two paths. One, find a vaccine, but also find a treatment. And on that front today, what looks like some positive news about one drug in particular. Christine Burak explains.
What we're going to do, Kay, is give you some that research medication now.
That drug is interferon beta. A group of COVID-19 patients in the UK inhaled it directly into their lungs. The study conducted by the drug company was small, just 101 patients, but the preliminary results seem promising. They claim patients who received the drug lowered their risk of becoming more seriously ill by almost 80% and more than doubled their chances of recovering. They were also released from hospital after an average of 6 days instead of 9. This could be a big step forward in treating COVID-19, but the actual data behind those findings has not been released by the drug company or reviewed by other scientists. Larger trials are needed, but Canadian researchers say this drug could work.
Regardless of what the virus is, whether it's a respiratory one, it's through a mosquito bite, the very first thing your body does is make interferon.
When a virus enters a cell, our immune system produces interferon molecules to interfere with the virus's ability to copy itself. But this coronavirus is able to get rid of them, which is why added doses could help. Drugs similar to the one tested are used to treat liver infections and even cancer, but doctors say there are drawbacks.
The reason people don't jump to use it immediately is it's kind of non-specific. It's like turning on the whole defense system to block one bullet,
which can lead to serious side effects. By inhaling interferon directly into the lungs, many hope it will be more targeted. The drug maker is preparing to show its trial data to regulators.
When we've talked to them, we'll work out what gaps there are in the data package, and we'll look to fill those gaps and work towards getting this drug approved.
Thereby repurposing an old drug to fight a brand new virus. Christine Burak, CBC News, Toronto.
British Columbia is moving ahead with tough new vaping regulations in hopes of keeping the products out of the hands of young people. Flavored products will now be restricted to adult-only stores, with limits also being placed on advertising and the amount of nicotine in those vapor pods. The province also announced a new youth advisory council that'll come up with ideas to reduce vaping among youth. Okay, next on The National, a Cleveland couple couldn't go to Toronto, so they brought a little Toronto to them.
People talked about Casa Loma, so I made this big blanket fort, and then inside I strung up lights.
This very creative vacation is our moment right after this. Well, a couple from Cleveland, Ohio had planned to spend their second anniversary taking a trip to Toronto, but then the border closed. So they had to get a little creative and decided instead to bring Toronto to them, and that is our moment.
I had an old coworker who was actually Canadian, and I was asking him if he knew any places, and the first thing he said was Toronto. We got to the point where it was like, well, okay, I don't even think we can travel, so I had to get a little creative.
Since we were going to stay a night at Niagara Falls, I made our front door look like Niagara Falls. I set up like a fake sports bar, and I made a playlist of different sports highlights from Canada. People talked about Casa Loma, so I made this big blanket fort. And then inside I strung up lights, and I bought celebrity face cutouts, like taped them on the inside so it looked like we were hanging out with Canadian movie stars.
I like doing puzzles, I guess, so she came up with the idea to get like a 3D model of the CN Tower. It was so exciting to see all the different places because like all the rooms just kind of completely just shaped up and looked completely different.
It was really fun because I was able to learn a lot about Toronto.
Did you see the ketchup chips there? Come on, that's amazing. That's amazing. And their second anniversary, are you kidding me? I don't even want to know what they're going to do for their third and fourth. But Niagara Falls on the door, that's got to be my favorite part of that whole thing. That's The National for this July 20th. I hope you have a great night.